Hi, this is a few brief thoughts about COVID. I realize it's been quite a few years since I posted anything about COVID. So I saw a patient yesterday with COVID, and I thought, yeah, I'd like to talk a little bit more about COVID. And, COVID is now something that's just, going to come around, especially during flu season. So good to be thinking about it, staying uh, present to it. So there's a few things about COVID that I want to emphasize. Um, I think so far in America, there's been about 1.1 million deaths from COVID, and America has about 340,000 people, a million people. So it's about 0.32% death ratio per head of population. If we look at how many people died in China, um, you have to kind of dig a little bit because it's hard to kind of exactly do side to side comparisons of these two numbers because you have to take into account how COVID deaths are counted, if they're counted, and undercounting and overcounting and so on. But what we can probably pretty authoritatively say is that China has a what is it, 5 or 6, I forget, billion people. No, I think 1.45, something like that, billion people. And they had somewhere between 1 and 2 million COVID deaths. It's hard to get an exact number, but if we take the upper number, the 2 million number, which I think is probably actually a bit exaggerated, but if we take that number just for the sake of this argument, we can clearly see that China's death rate from COVID is about 3 times lower than America's death rate from COVID. So you would have thought it would be make sense in the whole sort of public discourse and discussion about COVID. If we looked at what was done, what is done differently in China compared to America. One of the things which is just typically not reported in the media in the United States is that in China, between 91 and 92% of all people with COVID were put on Chinese herbal formulas. So think about it. You've got a death rate that's somewhere probably between 3 and 5 times lower than America. What are the differences? Well, one of the important differences is that the majority of the patients were put on Chinese herbal formulas. And they have done some longer studies, some longitudinal studies, some looking back studies at what the effects of these Chinese herbal formulas seem to be. And what it looks like is exactly what myself and other of my colleagues in the world of Chinese medicine and herbal medicine and so thought, which is that it looks like you can take COVID, and if you put somebody on Chinese herbs, you can greatly reduce the likelihood that they will end up in hospital. In other words, you can impact the COVID such that the course of the COVID does not end in really serious problems. It's much less likely to, right? And that seems to be borne out through all the sort of evidence of looking at, Chinese hospital numbers and death rates and so on. So wouldn't that be interesting to somebody in America, in the mainstream medical system, that maybe you've got an intervention here that radically changes outcomes for a lot of people? So this exactly matches my observation of how my patients did, because I definitely put a few hundred people on herbal formulas to treat their COVID during the COVID pandemic especially, and I didn't see any of my patients hospitalized, and none of them died that I put on COVID formulas. Now look, I know that's not a medical study, but my anecdotal observation has also been matched by the anecdotal observations of tens of thousands of other Chinese medicine practitioners around the world that we all saw that it's not that difficult to intervene with COVID to make a dramatic difference. Now, why would that be? It's quite simple. And I think in order to understand this, it's important to demystify COVID. It's just another respiratory illness. Yes, there are some interesting and unique features, but fundamentally, it's just another respiratory illness. So the way the COVID virus typically, not always, but typically works is that it invades through the sinus cavities. The virus colonizes the sinus cavities and the throat first. And after some period of time that it's doing that, where the patient may be undergoing, fever, sore throat, stuffy sinuses, loss of smell, the virus is attempting to overcome the body's immune resistance. And then it starts seeding out viruses down through the whole body. And if it's successful, it can get those, viruses seeded down into the lungs, and those colonies in the lungs will start going. Now, in my experience with most COVID patients, that process took between 2 days and 9 days. Mostly more in the middle, right? But there were some people that went really fast. Some people it was more of an, out to sort of 7, 8, 9 days, that the virus had a two-stage impact. First, the sinuses and the throat, which is what you'd expect, right? Because it's an airborne respiratory viral illness. And so it's going to meet your first lines of defense. It's going to mainly colonize in there and then attempt to build up its colonies from there, seeding down into other parts of the body. So for most COVID patients, you've got this window of opportunity from when they first get the COVID until, it could be up to 10, 11 days after their initial presentation of symptoms, where you can put the person on the appropriate herbs that strengthens their immune response and attacks the virus itself, such that the virus doesn't go to stage 2. Stage 2 is where it's going into your lungs, and then you've got a lot of shortness of breath and wheezing and sputum and respiratory challenge. And at that point, especially if there's other pre-existing conditions, if the person's elderly, if they've got other lung conditions, kidney weaknesses, heart issues, diabetes, we know that that's going to greatly start to increase the risk that the person gets hospitalized. And once hospitalized, the likelihood of not recovering well from COVID goes way up. So basically, it's simple. At the first signs of COVID, I encourage you to seek out somebody like myself who knows traditional Chinese herbal medicine and who can figure out what stage it's at, what the presentation is, and put you on the right herbs.